Hello, I'm Jerry Kruse, the Dean and Provost of the SIU School of Medicine and CEO of SIU Medicine. All of us at SIU Medicine, the leaders, the clinicians, the teachers, and the researchers wish to assure you, the public, that we take the threat of the coronavirus very seriously. In collaboration with our community partners, we've developed policies and guidance that put two issues at the highest priority. First, the optimal care of our patients, and second, the safety of our patients, our employees, our learners, ourselves, and our community. At all times, we use the best evidence and follow the guidance of the CDC to make decisions that ensure that we are doing our part to reduce the number of COVID-19 infections in Illinois and in the SIU Medicine area of accountability. When questions arise, we must take rapid action to ensure that our policies and the guidance of the CDC are followed by our employees, especially those employees who work in clinical settings. The good news is that there has not been a trend for increase in daily new confirmed cases of COVID-19 infections for the past 2 weeks in either the United States or Illinois or the SIU Medicine region. The bad news is that there has not been a decrease in that number in any of those regions for the past 2 weeks. We are in the midst of the long plateau that has been typical for other nations who experienced a COVID-19 surge before the United States did. We are in a time of active mitigation of COVID-19 infections, and the end of this process of active mitigation is not yet in sight. We've done well in central Illinois. The number of confirmed cases in Sangamon County and the 8 bordering counties has shown no appreciable increase in 3 weeks. We've been able to contain point source outbreaks in senior living apartments, in a nursing home, in a treatment center, and in a specific zip code without broad spread of the virus into the community. That's good work. One other statistic is very important, and that is the number of cases per 100,000 population. In Chicago metro area, that number is 334 per 100,000 people. In the Springfield area, that number is just 48 infections per 100,000 people, just 1/7 of the Chicago amount. These things, the control of community spread and the low infection rate per capita, are a testament to your good work at social distancing and because you monitor yourself for the symptoms of COVID-19 infection. And while we have done a good job, our numbers are just flat. They have not yet started to recede. And so, we must remain vigilant in our behavior. From the perspective of disease control and the health of the public, now is not the time to relax or reject public health guidance for protection against surges in COVID-19 infections. Now is not the time to relax the social distancing measures that have been so effective in the areas of the U.S. where they have been enacted and followed. Persistence is difficult in long-lasting periods of change. Thank you for your great teamwork and your persistence during the pandemic. Thank you for your great attention to the measures that optimize health outcomes and safety. Thank you all for your attention to the changes that are necessary during the COVID-19 pandemic. Thank you also for your collaboration with our healthcare partners and with governmental agencies as we unite for a common cause. Moving your health forward, SIU strong.